thanks for joining me today. Today I'm going to be talking about the ramifications of clerical errors and also the impact of when a patient is afraid to speak up. We hear in the news sometimes about patients who die of infections or incompetent doctors, and this is true, but equally important are the ramifications of what I call seemingly small clerical errors that can have huge ramifications for a patient, as well as what can happen when the patient doesn't speak up. And after many decades of getting medical care myself and talking with other patients, I have concluded that this is just so important that it is actually sometimes a matter of survival for a patient to take notice of all these so-called clerical errors. And you have to speak up when you think something doesn't seem right or it isn't right. So I'm going to go over some examples of these clerical errors, and keep in mind these things can be widespread, can happen in the best hospitals in the country and with the best doctors. And I'm not here to cut down institutions or these doctors. They are under tremendous stress and trying to operate under the small time frame that insurance companies allow them at times, and we all make clerical errors ourselves at home with our own paperwork. But it is critical that we be alert and watch out for some of these things. So that's what I'm going to go over today. I had a friend who went to get a certain procedure done, and when he got there, he had fasted and driven quite far to get there. When he got there, they had to send him home because they had forgotten to tell him to stop one of his medications beforehand. Now, I was a patient getting ovarian cancer surgery years ago, and I was waiting for the surgeon to come into the room. They'd come in before the surgery and talk to you a little bit. And I'd fasted 48 hours, and it was mid-afternoon. I was wondering where the surgeon was, and finally came in. He said, "Boy, am I glad I found you. I had hunted all around and couldn't locate you. I almost gave up and canceled the surgery." Well, they had put me in the wrong room. Now, we can have situations with dental x-rays or CAT scans. Suppose a technician takes the x-ray and then determines he or she did not take it correctly, so then takes it again and perhaps yet again and again, and in my case 4 times. Now you have a lot more radiation. And if these types of errors continue to happen year after year, decade after decade, that radiation adds up. Now, to the dentist, it may seem like you had 1 CAT scan that day, but in reality, you had maybe 2, 3, or 4, however many times they had to do it over. We can have problems with labs, as I stated in a prior video, if your doctor or their assistant gives you an expired test kit. You may then have to do that test over. Or if you are not properly instructed as to fasting instructions, whether you fast or not, how long you fast, and so forth. I had a situation where my doctor told me to fast, and I did fast, but when I got the test results, it said that I didn't fast, so they had to reinterpret that all over again. We can have problems with prescriptions. I noticed a prescription dose seemed quite high once, so I questioned it, and it turned out it was 4 times higher than it was supposed to be, so-called clerical error. You have to also be sure, if you're taking, let's say, pills, for example, that you know what that pill should look like, and talk to your pharmacist if you have any questions in identifying that. You want to make sure you're taking the right pill and the right dose. We have sloppy labels. You know, those little containers they give you for your urine samples at the doctors and want you to fill in your name, date of birth. Well, the lines are so small you can't even squeeze the information in there, and half the times the pens don't work. Now, fortunately, sometimes doctors have pre-typed labels for that, but just the other day I ran into a situation where I had to do it all by hand. We can have a doctor or assistant use the wrong size blood pressure cuff on you, which can give you an incorrect reading, and we'll be talking more about blood pressure in another video. You can have a doctor who runs out of supplies, and I had this happen before each chemotherapy session. I had to be catheterized because of my bladder disease. Well, I got to my doctor's office, and they didn't have any catheters. So fortunately the stores nearby were open and they were able to go out and get some. So everything worked out. Otherwise my chemotherapy would have been canceled that day. I also caught an error in my chart one day. I peeked in my chart and noticed that the person who took my weight wrote down that it was 10 pounds higher than it really was, so I ran out and got her, and she changed it accordingly. And we have errors in our medical notes, as I mentioned last week, which is a big problem. So the bottom line of all this is you have to be alert as to what's going on around you, what could be going on behind the scenes, and if you think something is wrong, you must speak up. We cannot be afraid of that. Some patients told me they were afraid to speak up because they liked their doctor, or they were afraid that it would hurt the relationship between them, and that is understandable. It is something to be concerned about. We need to speak up anyway, because it's really a matter of your own health, and sometimes a matter of literally surviving. And we just have to realize that there are a lot of things that go on out there. So we don't want to let these types of things slip by. So be alert, stay safe, and I hope these insights have been helpful, and I hope to see you next Friday. Bye.